First, the highlights today. Benue government set to punish residents who default on COVID-19 protocols. New World Trade Organization Director General Mrs. Ngozi Okonjo-Iweala says world unsafe until all countries are vaccine covered. And Nigeria, United Kingdom, Denmark among countries with a newly discovered COVID-19 variant originating in the United Kingdom. According to the Minister of Health, Dr. Osage Hanire, Nigeria is willing to send experienced volunteers from its Centers of Excellence on Viral Hemorrhagic Fever to support the World Health Organization's measures to contain Ebola resurgence in the West African sub-region. He stressed that while it would be important to protect the sub-region from the catastrophic burden of dealing with two severe diseases of public health concern, it's also a renewed call on Nigerians to limit foreign trips only to very essential ones and to altogether avoid high-burden countries and those with particularly deadly disease outbreaks for now, so as not to pick up such diseases or become a vehicle for their importation. In the meantime, the Nigeria Center for Disease Control, NCDC, reported 574 new confirmed cases and 8 deaths in the country. Till date, 146,928 cases have been confirmed, over 123,000 have recovered, and the death toll stands at 1,761 recorded in 36 states and the Federal Capital Territory. As at today, we're close to 1.5 million tests that have been conducted across the country. The new cases, 574, were recorded in states like Kwara, Lagos, Edo, Ondo, the FCT, Kano, Ogun, Kaduna, Osun State. Enugu recorded 23 cases, Rivers 18, 16 were recorded in Delta State, Akwa Ibom recorded 15, Bauchi 12, Imo 10, 8 in Borno, Niger recorded 8, Kebbi 7, Nasarawa 5, 3 in Gombe and 2 in Ekiti. While the country awaits its vaccine delivery, the federal government has inaugurated the Vaccine Coordination Committee, an interministerial multi-sectoral committee to address diverse issues peculiar to COVID-19 vaccine acquisition by Nigeria. The Benue state government has warned against flouting the presidential executive orders on the use of face masks and other forms of non-pharmaceutical safety measures as the state continues to work on curbing the new variant of COVID-19. The state deputy governor and chairman of the state's Action Committee on COVID-19 disclosed this while speaking to Channels Television on the enforcement measures, but expresses hope that the new treatment regime is far better than the use of chloroquine.
People in marketplaces, major roads, and other public places in Benue State showing open defiance to protocols on the use of face masks and other non-pharmaceutical safety measures. A lot has been done to enlighten the people of the state on the need to observe the NCDC protocols. But, as it is today, very few people are complying to the rules, while many choose not to.
Corona is real, and we are all humans, and we are born to make mistakes, but it's better we prevent it than to start facing the consequences later. I usually wear my face mask, but I just forgot it at home today.
At times, if you wear it, you're not comfortable. That's why at times I'm wearing 30 minutes, remove it, and put it back. So I said to the market to be also wearing it because it protects us. It's very, very good.
The government of Benue is appalled by the low level of compliance, and the state says the government could no longer tolerate this irresponsible act of the people.
So what we have done now is that we have sent people to marketplaces, to churches and mosques, to various organizations, and to various villages and towns in Benue State to create awareness of this very variant, which is the most transmissible in comparison with the previous one, and which also is a lot deadlier. And so what we have decided to do is that we not only let people know about this, but we have also keyed into the federal government law, which states that if you are found in a public place and you are not wearing mask, you are liable to arrest and upon conviction, go to jail for 6 months or pay a fine.
Benue State and the country at large is facing a big challenge in how to make the people comply fully to the safety measures put in place by the NCDC. But if it means wielding the big stick, the Deputy Governor says government will not mind doing so, insofar as it will help in saving lives.
Cancer survivors in Taraba State are advocating that the state government establish a more comprehensive diagnostic center to create a distinction between the ailment and COVID-19 symptoms. Speaking on behalf of the survivors in Jalingo, the state capital, during an awareness campaign, Adiza Bello insists that COVID-19 is raising cancer deaths. She adds that a lot of them died during the national lockdown due to difficulty accessing good treatment. The state government, on its part, says it will soon commence diagnosis and early treatments to avoid associating COVID-19 pandemic with the cancer ailment.
The people that die of cancer during this COVID are more than people that die with coronavirus. Why? Because they are used, their treatment is abroad, and they cannot travel abroad when the time reach for their treatment, and there's nothing they could do about it. I was contacting with 2-3 people if I can help them, but they're not able to because of the lockdown worldwide. They're not able to travel, and definitely they died. And even we have this thing center in Nigeria, even by foot you can be able to come. You don't need to travel.
The Minister of Health, of course, is part and parcel of this. The Ministry of Health is entrusted with healthcare, provision of healthcare in Taraba State. We have programs and activities that relate to cancer care, even though we have not started running a cancer program in the state. But our hospitals are there. The government is upgrading a lot of them to be able to provide some of these services that can assist in diagnosis and ultimately leading to early care for cancer patients.
The Director General of the World Trade Organization, Dr. Ngozi Okonjo-Iweala, has highlighted the need for equitable access to COVID-19 tools. Listing key priorities for her term, she said it was important for the organization to work with Global COVAX Facility, other ACT Accelerator initiatives co-sponsored by WHO and a range of other UN agencies and public-private partnerships to speed up vaccine availability. According to her, vaccine nationalism does not pay, and she plans to work to see what the WTO, under the trade agreement, using all the flexibilities so that countries can manufacture vaccines and low-income countries can get access and quickly.
I've been in politics in my country. I've been a minister. So when this kind of thing happens, it's very natural for leaders and politicians to want to take care of their own population. There's nothing wrong with that. The problem we do have is that the pandemic is a problem of the global commons. So taking care of your population and being nationalistic with respect to vaccines won't work this time, because even if you get all of them vaccinated and there's a country down the road that hasn't done that, it will come back in the way of variants. So one of the things that one would like to do is to work very hard to see what the WTO can do with under the TRIPS agreement to use all the flexibilities possible to allow countries to manufacture the available vaccines so that there can be more for poor countries quickly. And this will be a great support to the COVAX facility, which Gavi and the WHO have put together. Actually, the WHO, Gavi and CEPI have put together what is called the ACT Accelerator, which I mentioned in my speech, designed to speed up availability of all these things to poor countries. So how can WTO support that? By exercising, members exercising these flexibility.
Well, the federal government is planning to vaccinate about 109 million Nigerians against COVID-19 in the next 2 years. Joining us, Dr. Mr. Jalili Kelani. He's the chairman, Pharmaceutical Society of Nigeria, the FCT, member, National Executive Committee, the Association of Hospital and Administrative Pharmacists of Nigeria. He joins us from Abuja studios. Thank you for joining us on the program.
Thank you. Good evening.
All right, welcome. We'd like to know what your take is.
Yes, I'm now immediate past chairman of PSN.
All right.
We have conducted our election. I've handed over just last January 28.
Thank you for that correction. What's your take on the vaccines coming in and its efficacy, especially against the new variants?
Okay, the new vaccines coming in is a welcome development. And what we learned is that the government has actually concluded that about 4 types of vaccines should be accessed and should be evaluated and validated by NAFDAC. There's the one from Russia, Sputnik V. There's the one by AstraZeneca, and then the Covaxin, and then the one from China. So these are going to be evaluated and validated so that we can know how safe they will be in our population. So the government is actually doing everything possible to make sure that the population is protected from this COVID-19 pandemic.
If you were to advise, which of the vaccines that are being used around the world would suit Nigeria's situation, if you were to advise?
Yeah, the ones that will suit Nigerian situation will be the ones that will be easy to maintain the cold chain. That is the ones that could be stored within the temperatures of 2 degrees to 8 degrees centigrade, which is actually the one that our fridges can actually maintain. That's why the other types of vaccines that, like the one by Pfizer that has to be maintained at the temperature of minus 70 degrees centigrade will not be okay for us because we do not have the facility to maintain such, the cold chain for such type of vaccine. But the other types that are made by like this other, these 4 I've mentioned, which NAFDAC has been given the mandate to evaluate, they are okay for our own environment here because we should be able to maintain the cold chain for the time they are with us before they get expired.
But even with the storage and the cold chain expected, and for example, AstraZeneca vaccine, sometimes, I mean, it's not sometimes, there's some places that lights, I mean, can go off at any point in time. So in that scenario, if we have an AstraZeneca, for example, stored normal fridge temperature, as you mentioned, and there's power outage, yes, how long can the vaccine stay before it becomes ineffective?
Yes, when we have power outage and vaccines are stored, they can be maintained for up to like 28 days, or like 1 month. So after that, you know, one cannot be able to guarantee the safety or the efficacy of such products. So one will just advise that the government, and I also believe that the government is putting measures in place to ensure that the cold chain of these vaccines are maintained. And one thing we have to know is that even if there's power outage, I find that the temperature of the fridge may still be maintained over some time. But the fact is that we should not take chances. We should ensure that the cold chain is not broken and that we're able to maintain, because once the integrity of the vaccine is compromised, then we will not be able to guarantee the safety and the efficacy of such products. So, but by and large, I think the government, and just like the Minister of Health has been confirming, that measures have been put in place so that these facilities to store these products are being provided, and that everybody's aware. The pharmacies are already being put on alert that so these products have to be properly maintained so that people will get the right product so that the right outcomes will be obtained.
All right, many thanks. Thank you so much, Mr. Jalili Kalani, Immediate Past Chairman of Pharmaceutical Society of Nigeria, FCT. Thank you for joining us on the program.
Thank you for having me.
Still ahead, do we have the South African COVID-19 variant in Nigeria? We'll find out more about that and other stories when we return. Welcome back. A COVID-19 genomic sequencing group is to begin meeting in Nigeria to track and study different variants of COVID-19 in order to determine their transmissibility and pathogenicity. The Director General of the NCDC said this at the weekly PTF meeting while confirming that no case of the South African variant of COVID-19 has been found in Nigeria. He also urged residents to keep adhering to the COVID-19 protocols until vaccines are available.
We've now confirmed a total of 29 cases of the B117 variant. This has been confirmed in Edo, Kwara, Lagos, Osun, Oyo, and the FCT. So we continue looking out for this and working towards mitigating any impact it might have on our response. It's important to say the B1351 variant, the dominant strain in South Africa, has not been detected in Nigeria. We continue to look for it, but we haven't found any, which is good news. So this week, on Wednesday, a new group, the COVID-19 Genomic Sequencing Implementation Group for Nigeria, will meet for the first time with representatives from the 3 institutions with the capacity for sequencing at the moment, as well as a number of advisors from academia, both within the country, from WHO, and from a few external advisors, including the Wellcome Trust. Some countries across the world, like you know, have begun to see a decline in the number of new cases. This is most likely to be attributed to the introduction of vaccines in those countries. And we're very happy that our sister agency, the National Primary Healthcare Development Agency, is working very hard and leading our engagement to start this vaccination campaign in Nigeria as well.
Joining us now is Dr. Samuel Okowo. He's a general practitioner, also a member of the Nigerian Medical Association. He joins us here in Lagos. Thank you for joining us.
Good afternoon.
All right, let's start with the measures. You're with the General Hospital, Shomolu. I mean, since the first wave, is that still the highest index of suspicion for any patient who comes to the hospital as we battle the second wave?
Okay. The first wave actually made us understand more about the virus, and the tension is really down. So now when we see patients in outpatient in the clinic, what we really do is we maintain the standard infection prevention and control. We see them, we try them, and if we feel that really they have the virus, there's a way we limit their movement within the health facility and refer to the closest facility center, to testing centers around us, which are closed in different local governments, especially within Lagos, and they'll be followed up from there. So the tension really has come down compared to the first wave.
But there's also an isolation area as well in the hospital.
Yes, all hospital clinics now in Lagos, General Hospital, we have isolation wards that we hold our patients, the really bad patients that we know we can't transfer, at least to stabilize them, give them oxygen and make them much more comfortable before referring them to the isolation centers.
We're hearing new variants coming up, the UK variant, and then there is the threat of the South African variant. With all of that, and looking at our efforts in testing, we're approaching 1.5 million. Do you think that we've increased testing, or we've sort of stopped or reduced our testing capacity with the hope that vaccines will kick off soon?
Okay. The question, it is in both ways. Really, if what we did is this, since we've noticed how the virus really works, that so many people could actually be asymptomatic, not posing much threat to their health, so we give preference to those that are symptomatic. So when they come in, those that have symptoms, breathing difficulties, they have symptoms of hunger damage, we give them preference to be tested in the public labs. But people that felt that maybe they were exposed, they went to gathering, or they just want to know their status, such people, we advise them to go to a private lab to get tested. So it's both ways. I can say testing facilities, testing capabilities has increased over the time because we now have private labs and we have public labs. So we give preference to the symptomatic patients.
But another question is, when you look at the numbers from December when we were certified second wave, and then we were recording over 1,800, even 2,000, and then now, in the last 2 days, we're seeing just a little over 500 cases. What do you think is happening?
Okay, it is expected because, as it said, in every great pandemics, just like in the Russian, the Spanish flu of 1918, it comes in waves. That's why it's called waves. It comes, the figures build up, it peaks, and so that it declines, and it peaks again. Now, the amount of waves we have depends on our reaction, how conscious we are, how cautious also we are in the society. So that's why the advocacy of we Nigerians, especially, to be responsible, use masks, ensure social distancing, because it will peak. It's natural. That's how all viruses behave. It will peak, it will drop. So it depends on how conscious we are that will now determine how many waves we have. We can have the third, fourth, fifth, sixth wave, and the more the waves, the more the casualties. So that's advocacy.
And Dr. Okowo, it seems you're very cautious because I can see you have your hand sanitizer with you.
Like I said, we follow the standard prevention and controls in our facilities.
Indeed. Thank you so much. Dr. Samuel Okowo is a general practitioner and member of the NMA. Thank you for joining us.
You're welcome, ma'am.
UK scientists say they have identified another coronavirus variant in the country with some potentially troubling mutations. Professor Ravi Gupta from the University of Cambridge is one of the scientists. He says the B1525 appears similar to the South African variant, which prompted the door-to-door test in areas where it has been found. It appeared to have significant mutations already seen in some of the other new variants, he says.
The discovery by the scientists comes as the UK launches the world's first trial to evaluate the immune responses after people get mixed shots during the usually 2-dose vaccine regimen, an attempt to increase the flexibility in vaccine supply and delivery. More than 800 volunteers aged 50 and above will be recruited for the trial. They will be given 4 different combinations of the first dose and the booster one. A first dose of the Oxford AstraZeneca vaccine, followed by boosting with either the Pfizer-BioNTech vaccine or a further dose of the Oxford AstraZeneca vaccine and vice versa. Speaking of trials, Director of Center for Public Health Research at the Medical School of Nanjing University, Wu Ziwei, says it will take much more efforts in trials to address the safety and efficacy concerns over mixed vaccine uses in COVID-19 vaccination. Japan has only just received its first batch of COVID-19 vaccines ahead of the country's inoculation drive, which is scheduled to begin from tomorrow, Wednesday. The government officially approved the Pfizer vaccine on Sunday, the first of such approval in the country, grappling a third wave of infections. Australia's medical regulator says it has granted provisional approval for the COVID-19 vaccine developed by AstraZeneca, making it the second vaccine to get regulatory approval in Australia. The regulator last month approved the Pfizer-BioNTech COVID-19 vaccine for use and inoculations for its 25 million people, which will begin from February 22nd. Finally, New Zealand has recorded no new COVID-19 cases today on the second day of the 3-day lockdown in Auckland. The city's nearly 2 million residents plunged into a new 3-day lockdown on Sunday after 3 new COVID-19 cases were detected in the country. The more transmissible UK variant was confirmed to be involved on Monday, marking the first time the strain had been detected locally.
Continue to take responsibility. The virus is still very real, and the non-pharmaceutical protocols are the best way at the moment. So essentially, if you need an update on the pandemic, you can take a closer look at our website, channelstv.com. You can find a better understanding and the latest stories on the pandemic. As you can see, we have Brazil's COVID-19 vaccination campaign that is apparently off to a chaotic start. It's happening in several other countries as well. You can find other stories on our website. That's the program. Thank you for watching. I'm Millicent Walker. Stay healthy.